In vitro fertilization is a technique that has been available since 1978. And basically what we do is we obtain eggs from mom, sperm from that, and we fertilize them in a petri dish. Then we cultivate them for approximately 5 days. So from 2 cells, sperm and an egg, now we have 200 cells. And we transfer one of those inside the uterus. And currently, as it is, the best that nature can do per month is 25%. We are now, in certain cases, above 60%. So we are doing already 2-3 times nature in pregnancy rates.
And so let's say a couple comes in and wanting to go through the process. What are treatments and procedures looking like for a couple?
Yes, so because Pozitivf is streamlined and we don't want them to wait, we make the process simple. You need 3 things to get pregnant. You need a sperm, you need eggs, you need a place for them to have a date. So basically, we do a test for each of those before we give you a treatment. So we do, for the eggs, we either do a blood test, it's called AMH, anti-Mullerian hormone, or we do an ultrasound and count the follicles, intrafollicular count. For the semen analysis, for the sperm, we just check a semen analysis and make sure that there's adequate number and motility of those sperms. And finally, to check the tube and the uterus, we do a sonogram. No longer those painful HSGs and other surgeries that people used to do. We do it here in the office. It's a sonogram with water and a special micro bubbles that we can see the tubes. So after those 3, and we basically want the patients to have those before the first visit. And during the first visit, 100% of the patients come out with a plan.
Awesome. And I know from my mom's experience, it took a toll on her body. How does that happen? Or how does it take a toll on the body exactly?
Yes, well, it's a combination of physical, mental, emotional, and financial toll. That is, unfortunately, the reality of in vitro fertilization that we have been doing in the same way for 43 years. Because patients want to succeed, they have a lot of pressure from family, from society, from themselves. So emotionally can be a very charged process. So what we do is to make it simple. We have a strong mind coach that actually helped them out throughout the process. Actually, that is strong mind coach and myself, we wrote a scriptotherapy book that actually helps the couples go through the process a little bit easier.
And how are you and your staff making sure the couple is staying positive and not trying to get into a dark place exactly?
No, so that's a very important thing, Tony. We basically are cheerleaders because we have to help them out at any point. I don't know if you noticed, but in the waiting room, when you check out, it says, if you're feeling less than B+, please ask anybody and we'll give you a hug. So we actually need to be checking in with the patients and encourage them. And as I mentioned, we have a strong coach, a strong mind coach, and she gives certain tools in order to help them out.
And why is IVF kind of like a go-to for a couple who's unable to get pregnant on their own?
Yes. Well, number one, it is the most effective one. And a lot of people want to make it very complicated. And there is only really 2 tools that we have available. In fact, one of them is when you intrauterine insemination. A lot of people confuse intrauterine insemination with in vitro fertilization. They're 2 different things. Intrauterine insemination is when you give the woman some medication to ovulate and enhance her ovulation. We then obtain the sperm and we put the sperm inside the uterus. The pregnancy rate with that is going to be rather low, 10 to 15%, depending on the age of the woman. And the IVF, as I previously explained, is obtaining the eggs, the sperm, you fertilize them outside. What are the difference? Are three main difference in those tests. One of them is cost, certainly. The second one is effectiveness. And the fourth one is complications, because a lot of people, unfortunately, because of the past, Octomom and other things, think that IVF generates a lot of multiple pregnancies. Not anymore, because we're so good that rarely we transfer more than one embryo. While in the intrauterine insemination, you put the sperm and you cannot tell the sperm, say, hey, just fertilize one. If there's more than one, they fertilize more than one. So currently, the higher order multiple pregnancies usually come from intrauterine inseminations and not from IVF. That's a very clear distinction that a lot of people unfortunately do not understand currently because of the previous history of multiple pregnancies with IVF, but it's no longer the case, fortunately.
And does in vitro fertilization, I hate to use this word, guarantee a pregnancy, or how effective?
No, it does not guarantee. However, we have certain guarantee programs, for example, at Pozitivf, that you pay for a certain amount if you fit certain characteristics, and yes, we can guarantee you a baby in hand or your money back. So there's that. But one process of IVF does not, because even nature, the best that nature can be successful in a given month is 25%. In other words, if I have 100 women that are 26 years of age, and they have had already 3 kids, and the 100 women are ovulating tonight, and the 100 women are having intercourse tonight, only 25 will have a baby 9 months later. It's very low. So we are nowadays in pregnancy rates of 50s and 60% per cycle, which is 2-3 times nature. But it's not, unfortunately, 100% guarantee per transfer.
We were talking about the costs earlier.
Yeah.
Why is it so high? I know you all work around it, but why in general are costs so high for in vitro fertilization?
There are various reasons. One of them is that the medications that we're using represent 30 to 40% of the cost. And the medications is a significant burden. 2, unfortunately, we don't produce a lot of fertility specialists in our country. We only produce close to 50 fertility specialists every year, besides the ones that are retiring. And we are 340 million people in the country. So that is basically one fertility specialist for every 8-9 million people. So certainly not enough.
Hey, and in San Antonio, you can give me just like kind of general,
Yeah.
how many patients are you seeing? What's like the percentage of women who need your help in this city?
Well, in the city and in the whole country, from 100 women that need IVF, probably 10 or 20 are getting it. And that's the whole idea of Pozitivf, that we wanted to make this more affordable. So to answer your question, from 100 people that needs it, only 10 to 20 are doing it. We are seeing approximately 1,200 new patients a year. So we are certainly growing, and now we open Houston. So we are doing currently close to 500 IVF cycles a year.
Oh, wow. And now getting into President Trump's executive
Yeah.
order, what were your initial thoughts on the president's executive order to come up with a plan to lower costs and make it more accessible?
So as I mentioned before, we welcome the presidential announcement because it brings attention to a very important topic for several reasons, for reproductive justice reasons, for economical reasons, and for the importance of increase the fertility rate in our country, which is declining. So for all that, we do it. We also take it with a little bit of grain of salt, because we know that there is limited amount of things that can be done at the federal level. However, we will have to be patient and wait for the 90 days that the president said it will require to come up with a plan. So we welcome, this is a good idea, but even if tomorrow everybody will have coverage for IVF, the truth is that we don't have all the human capital to satisfy that need. So we also have that challenge.
And you were also talking about the challenge of, sorry, I lost my train of thought. I was
Yeah.
my next question. If it does reduce costs, do you believe more people will look into IVF?
Yes, there is actually a very nice study that was done about decreasing the cost of IVF and increasing the utilization rate. So for every 1%, and I can give you this article, for every 1% decrease in the price of IVF on the disposable income, which in the United States is around $50,000 to $60,000 per year, for 1% reduction on that, on the cost of IVF, there is a 3.7 increase on utilization rate. So there is no question that reducing the price of IVF is going to increase the utilization rate.
And why should it be more accessible? You're talking about how not a lot of people think that this is a public health necessity.
Yes. So there's three main reasons why IVF should be covered. The first one is because it's the right thing to do. Having a healthy child is a universal human right. So reproductive justice is one. Two, economically, nobody thinks of IVF as a tool as powerful as vaccinations. Vaccinations prevent disease, and that's how they are important. Well, IVF with PGTM, basically we can identify a lot of the genetic traits that causes a lot of the hereditary diseases like cystic fibrosis, SMA1, a sickle cell. There is a myriad of diseases that can be prevented via IVF and save the healthcare system millions and billions with a B of dollars with a very small investment. So the return on investment, the calculations that we have done for each dollar that you invest in genetic disease prevention is going to give you a 1,000 return of investment.
Is there anything else I may not have asked that you wish to say about?
Well, the third reason why this one is very important is for geopolitical reasons. Because in order for the United States to remain the leader in the world, we need more people. We need more people, and our fertility rate is 1.6, and every society needs 2.1 fertility rate. And you can see what is going on in Europe, where there is actually a lack of people in the working age to sustain the great majority of people that are becoming less young, old, and the social security system and retirement system will have a big strain. So those are three very valid reasons: reproductive justice, economical burden that we can avoid, and geopolitical fertility rate issues.
Is there anything else?
No, I think the idea that fertility treatments is only for the rich. It should be eliminated, and that's basically the philosophy of our company, that we want to democratize the services.